All right, now let's talk about that scary edema, pulmonary edema. Okay, it's one thing to have a little edema down in your feet. It's very uncomfortable. You might not like it, but in the lungs, this is dangerous. Pulmonary edema is bad, All right, causes of pulmonary edema, things we're looking for on step one. The most common cause is cardiogenic. All right, the heart's not pumping. The heart's not pumping well. And if we're talking about the left ventricle, then things are backing up. Think about your sink backing up. If your sink backs up, gets clogged, so it doesn't drain well, then it backs up. If the heart doesn't pump well, then the fluid backs up. Yeah. And this is the most common cause of pulmonary edema. Because I'm not ejecting blood, this increases left atrial pressure, which is venous pressure. Venous pressure, exactly. This is venous pressure on the pulmonary side that increases capillary pulmonary pressure. Bingo, fluid extravasation, pulmonary edema. Pulmonary edema. See, you just applied basic fundamental concepts. All right? Yeah, the marker of that is wedge pressure. Initially, the lymph will kick in and they are protective, but you can overwhelm the lymph. First patient sign is orthopnea, which is difficulty breathing in the supine position. So how do we help that? Well, sit them upright. Sit them upright. That can help. Somebody mentioned pulmonary wedge. Yep, there it is in the book. Pulmonary wedge provides confirmation. Pulmonary wedge pressure is your marker of left atrial pressure. Treatment, do something to reduce left atrial pressure. Get rid of some of the volume. For example, diuretics. Sitting them upright helps decrease blood in the heart as well. So, very dangerous edema. Now, the other form of edema that we need to think about pulmonary-wise for step one is adult respiratory distress syndrome, ARDS. This is due to injury of the alveolar epithelium. Okay? Big increase in capillary permeability. So clinical signs, severe dyspnea of rapid onset. Okay? Man, they're pulling it out. You're putting that fluid in there very quickly. So they have great difficulty breathing. Remember, dyspnea means difficulty breathing can ultimately lead to respiratory failure. This is ARDS, respiratory failure associated with this. All right, most common cause, one thing to look for on the step exam, the big one will be sepsis. Now, other pneumonias can certainly do it, trauma, gastric aspirations, but sepsis, and I would think pneumonia. Those are the top two I would look at, sepsis being a big one. Once you get fluid accumulation, you're going to break down the epithelium. Okay, water is going to get in there, will inactivate surfactant, which means lung compliance goes down. So it's more difficult to breathe. Okay, and we'll go into great detail about compliance and elasticity of the lungs when we get to the respiratory system. Pulmonary wedge is often normal or even could be low. Even though we have pulmonary edema. Okay? So, these are some of the high points, the high yield things to think about for step one related to pulmonary edema. Again, the primary cause is cardiogenic, left ventricular failure. And this can happen very rapidly as well.